Hi, I'm Dr. Margie Rosa, a board-certified veterinary pathologist at Independent Veterinary Pathology. Today I'm going to show you how to make a cytological preparation from an FNA and show you a few tips and tricks on how to make the most out of your preps. Firstly, it's important to know in the veterinary world what is suitable for cytology and what is not. Some lumps, in general skin lumps and lymph nodes, are excellent for cytology. Whilst they might not give you a definitive diagnosis, they often give you enough information to guide you as to what your next step will be, whether that's medical therapy or a surgical excision. There are some lumps, such as cysts and vascular tumours, which are not great for cytology because they tend to exfoliate poorly into the fluid component, and unless you're aspirating the solid part of the mass, you'll often get a non-diagnostic specimen. The other thing that's not great for cytology are mammary tumours or mammary masses. Cytology, whilst it can guide you as to what is malignant, histopathology is the definitive diagnosis on that. There's only about a 20% correlation between cytology and histology for malignant or for any mammary tumours. So you're better off just excising those masses, sending them in for histopathology where we can subtype them and grade them. On to the setup. It's really important to be set up before you're going to take your FNA because you need to do things quickly. So you'll need a bunch of slides set out and pre-labelled. So have a pencil and write down the patient's name and the site on the frosted end. Most labs will accept between 6 to 7 slides per site, so make sure that you've got enough out there just in case you're not getting very cellular samples. The other thing you'll need are extra slides for spreading. You'll need some needles, like these ones, and a syringe. Now my preference is for a 23 gauge needle. You can use anywhere between a 21 to a 25 gauge needle. The larger the bore, the more chance of hemorrhage, but some of the more fibrousy tumours require a larger bore to really exfoliate those cells, so you sometimes have to play it by ear a little. The other thing is I use a 3mm syringe. You can use a 5mm syringe too, whatever suits you in your hand. The 10 and 20mm syringes tend to have too much suctional pressure behind them, so they're not that suitable for cytology. FNA is a bit of an art form and you need to work out what works best for you. Today I'm going to show you two techniques. I'm going to show you the Capillary Action technique where we just use a needle, and the suction technique where we use a needle and syringe. The first technique I'm going to show you is the one without suction, the Capillary Action technique. So for this you're going to need your needle and you insert it into the mass, and then you need to redirect about 6 or 7 times. But when you redirect, you need to take the needle almost all the way out of the mass and back in a different angle. The reason you do this is because if you move the needle around while it's deep in the mass, you can create some shearing damage, which will create hemorrhage and maybe render your specimen non-diagnostic. So as soon as you see any blood in the hub of the needle, you need to take it out, make a smear and start again. But this one doesn't have any blood, so that's great. There we go. Take the needle out, pop the syringe on once you've filled the syringe with air. Then you want to gently express the material in the top third of the slide. So just about here. And then to smear the slide, use this one. Use the weight of the other slide on top, let it smear out, then in a continuous motion just pull the top slide along. There's the slide. It's a good one. It's ready for staining now. So this next technique is the gentle suction technique, where we have the needle attached to the syringe and you advance the needle into the mass, and then once you're in the mass you apply gentle suction. About 1/2 ml is all you need, and then it's the same principle as before. You redirect about 6 or 7 times with the gentle suction, coming almost all the way out of the mass with each redirection. release the suction, and then retract out of the mass. It's really important to release the suction before you come out of that mass, otherwise you can cause the cells to splat back up inside the barrel, which means they're lost to us, or you can create hemorrhage. So then, like before, take the needle off, pop some air into the syringe, and in the top third of the slide, gently express your cellular contents. There we go. Take a spreader slide. Using the weight of the slide only, drag the top slide along the bottom slide, like that. I hope this video has been informative, and if you have any questions or queries, pop them in the comments below. I've also made a summary card of this video and just popped it in the description box so you can download it from the link. Thanks again for watching, and I'll catch you later.